Good morning. How are you?
How are you?
My name is Mallory. I'm a Texas State Family Nurse Practitioner student, and today we're going to talk about your past medical history and your family medical history.
Okay.
So tell me, what brings you in today? Any problems or recent illnesses?
Been getting some shooting pain on my left forearm while working out lately, but usually occur when I work out and after I work out.
Okay, and can you tell me the onset of your pain? Was it a week ago, a day ago?
It's been ongoing for probably 6 months now.
6 months, okay.
Yes, ma'am.
And the exact location, is it only in your forearm? Is there pain in your elbow?
Just the forearm right here, this part right here, nothing else.
Okay. And can you tell me the duration of your pain? Is it just minutes? Does it last throughout the day?
Well, usually when I'm put pressure on it, during that instant, I'll get pain on it. And if I work out too hard, it's just kind of there for a little bit, but not that much.
So would you say your pain goes away within 10 minutes after working out, or is there a long?
Yeah, if I rest it, it goes away. Yes, ma'am, about 10 minutes after I work out.
Okay. And describe to me the characteristics of your pain. Is it a sharp pain, a burning pain?
Yeah, it's kind of sharp, putting muscle, tendon pain.
Okay. Any aggravating factors that cause your forearm to have more pain?
Nothing at all.
Okay. Anything that you do to relieve your pain? Do you ice it? Do you use Tylenol?
I usually take some ibuprofen afterward.
Ibuprofen? Okay.
And try to rest it, and it'll go away until I work out again.
Okay. And so that's kind of your treatment for your pain?
Yes, ma'am.
Okay. And how would you rate your pain, the severity of your pain, on a scale of 0 to 10?
Oh, not that bad. Probably a 2.
2 out of 10.
Yes,
okay,
ma'am.
Great. Let's talk about your childhood, if we could. Okay. When you think back in your childhood, did you have any childhood illnesses? The chicken pox, measles, mumps?
No, just chicken pox when I was in middle school.
Okay. About how old were you?
About 9 or 10.
Okay. And did you have any long-lasting effects because of the chicken pox?
No, not at all. They went away.
And as a child, were you vaccinated on a regular basis?
Yes, ma'am.
Any reactions to those vaccines?
No, not at all.
Okay. Do you get a yearly flu shot?
Yes, I do.
Okay. Have you ever had a tuberculin or TB test, one that goes in your forearm?
No.
Okay. And are you up to date with your tetanus vaccine within the last 10 years?
Yes, I am.
Okay. What about childhood injuries? Did you have any of those?
No. Only I broke my collarbone playing football in middle school. That was it.
So you broke your collarbone. Did you have to be hospitalized because of that?
No, they just gave me a brace to wear.
And how long did it take for you to heal?
About 6 weeks.
6 weeks. Okay. Have you ever been hospitalized during your lifetime?
No, never. Got lucky.
Okay. And any recent surgeries in your lifetime?
About 3 years ago, I did have a surgery to remove my one of my thyroid. I thought it was a thyroidectomy. I thought there was a cancer, so they took it out.
Okay. So you've only had part of it removed, so a partial thyroidectomy?
Yes, ma'am.
Okay. And then when they took a biopsy and sent it to pathology, can you tell me what the results? Negative.
It was
okay.
negative.
So no cancer.
No cancer.
It was benign result.
Correct.
Okay. Great. All right. Now we're going to talk about your personal history in relation to some diseases, and you just let me know if they pertain to you.
Sure.
Okay. Any cancer?
No cancer.
Okay. High blood pressure?
No.
Okay. Any high cholesterol?
A little bit on the border, but nothing that I need to take medicine for. So I'm working on reducing that.
Okay, great. Any liver or kidney problems?
No. Liver.
Stroke?
No.
History of asthma?
No, ma'am.
Okay. Have you ever needed a blood transfusion?
No, ma'am.
Okay, great. All right, do you take medications on a daily basis?
No.
Do you have any allergies to medications?
I have allergies to sulfate.
Okay, to sulfa drugs?
Yes, correct.
And what happens when you take those?
I just break out pretty much in little hives that last 5 to 10 minutes.
Okay, so would you say that's a mild, moderate, or severe reaction?
Pretty mild.
And no respiratory distress?
Nothing at all.
No anaphylaxis?
No, ma'am.
Okay. And then talk to me about any food or environmental allergies.
Well, I got stung by a yellow jacket once, and I also broke out in hives, and that lasted about 20 minutes, so that was kind of moderate.
Moderate reaction?
Correct,
No respiratory distress as well?
No, ma'am.
Okay. Do you exercise on a regular basis?
About 4 to 5 times a week.
Okay, great. Tell me about your exercise routine. What do you do?
I pretty much just lift weights. That's all I do. I need to do some cardio, but just lifting weight right now.
Lifting weights, okay. How about we move on to your family history, okay? We'll kind of go through one relative at a time.
Sure.
And discuss if they're living, deceased, maybe any health problems that they might have.
Okay.
Okay. Let's start with your mom. Is she living?
She is.
And about how old is she?
About 82.
About 82. And any known diseases or risk factors she might have?
Believe she has high cholesterol, and she also have hypothyroidism.
Okay, so hypothyroidism and high cholesterol.
Okay.
No kidney issues, liver issues, cancer with her?
No, ma'am.
Okay, great. And then tell me about your father. Is he living?
No, he passed away a while back from cirrhosis.
Okay. Was he a heavy drinker?
He was pretty heavy drinker, correct.
Okay. And about how long ago did he pass?
I believe about 7 years ago.
7 years ago.
Yes, ma'am.
Okay. And what about your mom's dad? Anything wrong with him?
My mom's dad has cirrhosis also, liver condition.
Oh, he had cirrhosis too?
And he passed away also already.
And he's passed away. Okay. So any known alcoholism that you're aware of with that family member?
I was just, not really. I was too young to know what happened there.
Okay, and what about your mom's mom? Any issues with her? Is she alive?
She passed away from pneumonia a while back.
Okay.
That was before I was born, so.
So as far as you know, she was generally healthy and then got the lung infection, pneumonia, and passed from that.
Correct.
Okay. Let's talk about your dad's dad. Is he alive?
He passed. I passed on a long time ago before I was born.
Okay. And do you know what he passed away from?
I believe he had a stroke.
Okay. And then, so you probably don't know, but did he have an ischemic stroke or hemorrhagic stroke?
I have no idea, ma'am.
Okay. Alrighty. And then what about your dad's mom?
I believe she passed away a while back also before I was born from Alzheimer's disease.
Okay, so she had Alzheimer's disease.
Correct.
And she passed from complications of that?
Yes, correct.
Okay. And what about aunts and uncles, nieces, nephews? Any health problems related to them?
No, they're all pretty healthy at this point.
Okay. And then do you have any brothers or sisters?
I have 3 brothers and 1 sister.
Okay, great. And are they generally healthy as well?
They're pretty healthy.
Okay, great. Let's talk about your personal and your social history. Are you married?
I am.
Okay, great. And do you have children?
I have 2 beautiful girls.
Okay. Tell me about your wife and your children and kind of about your home life.
We're very dedicated to our kids, and we love our daughters very much, and we like to be at home and taking care of them, and we spend quality time with raising our kids.
Okay, and how old are your children?
My youngest one, which is born, just turned 1, so she's about 13 months old, and my oldest one's about 2.5 years old.
Okay, and what do you do for a living?
I work for an insurance company. I actually do marketing for them.
Okay.
Lots of fun there, yes.
Okay. And do you feel like you support adequate income and housing for your family to survive?
Oh yeah. Yeah, I work hard to support the family, so yes to that answer.
Okay. And then do you live in a house or an apartment?
We live in a beautiful house that we purchased about 3 years ago.
Okay, great. Tell me about any dietary habits that you might have. Do you generally eat healthy?
I try to eat healthy. Try to slow down on the red meat. Well, I do like to eat a lot of protein, so I do eat a lot of chicken and fish, and try to slow down on the red meat. At this point, yes, ma'am.
Okay, and do you smoke?
No smoke. Never smoke.
Okay, are you a big drinker? Do you drink alcohol on a regular basis?
Just casual, maybe once a month.
Okay, and any illicit drug use?
Not at all.
Okay. Spiritually, religiously, do you define yourself as that? Do you go to church? Well, how do you stand on that?
Oh yeah, we definitely go to church every Sunday, the family and I, so very religious. Not too religious, but we do believe in another power, Jesus Christ and the Lord.
And in your church family, do you feel like you're supported by them? And do you enjoy going to church with your children and instilling those values in them?
Oh yes, definitely. Very important.
Okay, great. Okay, now we're going to go through kind of each body system now, and you let me know if some of these symptoms are happening to you, okay? All right. Do you experience fevers, chills on a regular basis, extreme fatigue, weight gain, increasing or decreasing?
No, not at all.
Any night sweats?
No.
Okay. What about any recent rashes?
No rash.
Any itching?
No.
Pigmentation changes?
No.
Changes in your hair, nails?
No, ma'am.
Okay. Abnormal hair growth anywhere?
No, ma'am.
Okay. What about frequent headaches? Dizziness?
No, never have a headache.
Head injuries?
No.
Concussions?
No.
Any maybe equilibrium imbalances while you're walking?
No, none of that.
Okay. Do you wear glasses?
Only when I'm driving.
Only when you're driving?
At
Okay.
night.
Do you have any blurred vision?
No.
Double vision?
No, ma'am.
Okay. Any light sensitivity?
No.
History of glaucoma?
No, ma'am.
Or any injuries to your eyes?
No.
Okay. Let's talk about your ears. Any hearing loss?
No, I think I'm fine.
Ringing in your ears?
Not really.
Any discharge from your ears?
No, ma'am.
Recent ear infections?
No.
Or any pain in your ears?
No, ma'am.
Okay. Any frequent nasal congestion?
No. Just the basic allergies.
Okay. Bloody noses?
Mm-mm.
Polyps?
No, ma'am.
Any change in your smell that you've noticed?
No.
Any frequent colds?
No.
Sinus pain?
No.
Okay. Do you go to a dentist on a regular basis?
Yes, ma'am.
Okay, great. Any recent dental problems?
No, not at all.
Okay. Any braces in your mouth right now?
No.
Any crowns?
No.
Any internal hardware in there?
No.
Okay. Any recent tooth extractions?
No.
Abscesses?
No, ma'am.
Any tooth pain?
No, ma'am.
Recent changes in taste?
No.
And what about voice changes?
No.
Bleeding gums at all?
No.
Any ulcers in your mouth?
Nope.
Okay. As far as your lymph nodes go, the one in your neck and underneath your chin area, any pain or tenderness around there?
No, I'm fine.
And then the ones in your armpit, any pain
No.
recently there?
No pain at all.
And then the ones in your groin area, any pain there?
No, ma'am.
Okay. What about any stiffness in your neck? Do you feel like you have full range of motion in your neck?
I believe I do.
Okay. For your lungs, do you struggle with shortness of breath, asthma,
Mm-mm. No.
frequent cough,
No.
any sleep apnea?
No.
Okay. For your chest, frequent chest pain,
No, no chest pain.
no heart attacks.
No, ma'am.
Have you ever been told you have irregular heartbeat?
No, ma'am.
Okay. Do you suffer with heartburn,
No, not really.
nausea, vomiting,
No, ma'am.
blood in your stools,
No,
increased abdominal pain?
no, ma'am.
What about hemorrhoids,
No,
gastric ulcers?
I don't think so.
Okay. When you're walking around, do you have extreme pain in your calves?
No, not at all.
Okay, great. Have you had any recent diagnostic screenings, an endoscopy or anything?
Oh, I had a colon cancer screening last month, and everything was fine.
Okay, so you had a colonoscopy, is
Yes,
that
ma'am.
correct?
Yes, ma'am.
Okay, and what were their findings?
They just found 2 little polyps in there, and they extracted out and sent it to pathology, and it came out negative.
Okay, and what was their recommendation on getting another colonoscopy?
Yeah, I was supposed to go back in 5 years.
5 years. Okay, great. Let's talk about your urinary system. Do you feel like you have to get up through the night to urinate a lot? Frequency
No.
of urination at all?
Maybe 2 times a night.
Okay. And does that interfere with your sleep at all, getting up twice a night?
No, not really.
Okay. Any painful urination?
No, ma'am.
Blood in your urine?
No.
A history of kidney stones?
No, ma'am.
Penile discharge?
No, ma'am.
Any testicular pain?
No, ma'am.
Any recent hernias or sexually transmitted infections?
No.
Are you able to get and maintain an erection?
Yes, ma'am.
Okay. Any stiffness or swelling in your joints?
No.
Any limited range of motion?
No.
Do you bruise easily?
No, not really.
Any history of blood clots?
No.
Bleeding disorders?
No, ma'am.
You mentioned you've never needed a transfusion before, but are you willing to get one if you needed one?
Oh, yes, definitely.
Any heat or cold intolerance? Excessive thirst?
No.
Excessive urination?
No.
An increase in your hat size recently?
No.
Okay, good. What about decreased libido?
No. No.
Do you feel like you went through puberty at a normal age?
Oh, yes.
Any issues with infertility when having your children?
No, not at all.
Okay. What about any muscle weakness, tremors?
No. Not at all.
Do you feel like your memory's intact? Any declining memory?
No, not at all.
Do you struggle with depression,
No.
anxiety?
No.
Any suicidal or homicidal ideation?
No.
Okay, great. Well, I think this concludes our health history today, and I really appreciate your time. Do you have any questions for me?
No, I don't have any question. Thanks so much.
Thank you. Nice
Thank
to
you.
meet you.
Nice to meet you.